Rosacea is a really common skin condition. It's sometimes called acne rosacea because, yep, along with the redness comes acne-like spots for quite a lot of people. Sorry. It affects about 1 in 10 people, and it usually starts between the ages of 30 and 60, affecting women more than men. It often starts off with temporary flushing that comes and goes, so of course it may occasionally be mistaken in a woman for menopausal flushes. However, with time, that redness tends to stick around, and you can also develop lumps on the face which look like acne-type spots or pustules. Much less commonly, you can get thickening of the skin, which leads to a bumpiness in the nose. That tends to affect men more, and it isn't common. The good news is that rosacea doesn't lead to any serious long-term damage. The bad news is that it can be pretty miserable to have. With respect to the flushing, well, there's not that much we can do in terms of medication. However, it is really important for flushing and redness to avoid harsh, abrasive cleaners to your skin, to avoid too much sunlight, to reduce your alcohol or ideally avoid it altogether, to avoid very hot, spicy foods and excess exercise or things that make you extremely hot. In terms of the pustules or the spots, well, antibiotic cream tends to be or has always been the treatment of choice, either that or antibiotic tablets. But interestingly, we're now looking at an alternative treatment. And that's because while we're not absolutely sure what causes rosacea, we think there may be a genetic element, it may run in families, it may be something to do with your immune system. We're now looking more at the possibility of a tiny mite that lives underneath the skin. And there is a treatment that's specifically designed to target that mite, and that can be very effective.